Okay, welcome everyone to another talk about the science of drugs. In these talks, we want to elevate the voices of early career researchers who are studying drugs. I'm Ivan, co-founder and director of Drugsemy. And Drugsemy, for those of you that don't know about us, is a social enterprise, and we want to help people make smarter and safer choices when using drugs by sharing content, creating knowledge, and developing software. Today we have Dr. Matt Hibbert. Hey, say hi, Matt. How are you?
Hi everyone.
So Matt finished his PhD in 2020 from Liverpool John Moores University, and today he's going to talk us. He's going to tell us about his research. He did research on drug use, sexualized drug use, and chemsex among LGBT people. Uh, and before his PhD, he worked in HIV and sexual health research, and currently works in hepatitis research. So before Matt starts, I need to tell you about two things. So the talk is going to be around 20 minutes. You can post your questions or your comments in the YouTube comment um, box, and we'll have after Matt's talk, we'll have a period of discussion with Dr. Dean Connolly, which is also joining us today. He will say hi later on, and yeah, we'll start the discussion. But please, if you have any comments, any questions, let us know, and we'll try to cover them all during the Q&A. So the Drugsme is a social enterprise, as I mentioned, and we're mainly run by volunteers. Most of us are still students. I'm a PhD student myself, and so as we develop software, we require funding to support the Amazon Web Services and the whole like software infrastructure. So we've got a Patreon in which, if you like the content, the work that we do, you can go and support us. The link is in the description below. And this talk is timely and relevant for us because we are proud to be supporting the work that Dr. Dean Connolly and Dr. Emma Davies are doing. They are doing research on alcohol consumption in UK transgender and non-binary communities. The research they're doing is approved by Oxford Brookes University, and it's invaluable because the research in this population is often neglected, and they face a specific and particular challenges when it comes to drug use. So if you live in the UK and you identify as transgender or non-binary, please click the link that is in the description, but don't fill the survey in. I know you can't wait, but what Matt is going to tell you, it's going to be interesting. You can open the link, just leave the tab there, and at the end, you can fill the survey in. Dean, we'll talk about this later on. So that's enough from me. Matt, please share your screen and tell us about your research. Thank you.
Thanks, Ivan. Just want to check, is that working?
Yes.
Perfect. Thanks. Hi everyone. My name's Matt Hibbert. I was a PhD student at Liverpool John Moores University, and so my PhD looked at drug use, sexualized drug use, and chemsex among LGBT people. So today I'm going to be talking about some of the findings from my PhD, looking at sex, drugs, and well-being, drug use among UK trans people. So first, I just want to start by defining trans people in the context of this research, at least. So for us, when we were conducting this research, a person may be grouped as trans when their current gender is different to the gender they were assigned at birth. So for us, this included trans men, trans women, non-binary people, as well as other gender identities. So it's estimated that 0.5 to 1% of the population in the UK are trans, although that is an estimate. And in the last census in 2021, they did include, in my opinion, an imperfect measure of gender, but nevertheless, there was a measure of gender there, and that will hopefully help us understand what and who trans people are in the UK context. So what do we mean by sexualized drug use and chemsex? So you may have seen the topic of chemsex in news articles such as what is chemsex and why is the British government so worried? The grinder killer that was recently played by Stephen Merchant in a BBC documentary, he was engaging in chemsex. It's associated with this hedonistic lifestyle, addiction, it's a horror story. And there was a famous case in Manchester recently where a man had date raped a lot of male victims and he used a chemsex drug as well. So this is one side of the story, and I'm not here to contest these experiences. These things did happen, but part of my research was looking at, is this the whole story when it comes to sexualized drug use and chemsex? So for a bit of background, sexualized drug use and chemsex has become an emerging public health issue among men who have sex with men. So chemsex is a specific form of sexualized drug use that involves the use of GHB, GBL, crystal methamphetamine, methadone, and ketamine taken immediately before or during sex. It's been raised as a public health issue because it's associated with condomless anal intercourse, an increasing number of sexual partners, sexually transmitted infections, living with HIV, and accessing pre and post exposure prophylaxis. So those two are drugs that you can take to reduce your likelihood of acquiring HIV. So we know sexualized drug use has existed for some time, but research has shown, as well as clinicians, as well as people engaging in chemsex, that this is increasing. And it suggested that the use of dating and hookup apps, such as Grindr, are the reason for those increases. So reasons suggested for engagement in chemsex and sexualized drug use, such as internalized stigma or discrimination, may also apply to women who have sex with women and trans people, but these two groups have received very little research and attention in comparison to men who have sex with men. And research into sexualized drug use and chemsex has often neglected the impact on psychological well-being. So it's important for us to focus on the sexual health aspects in terms of preventing onward transmissions of sexually transmitted infections, for example. But part of my research was looking at how does this fit in with the overall individual as well? Is there any impact on well-being or mental health there? So that moves me on to, what do we know about trans people and drug use? Well, in a UK context, the answer is not a lot. There's been one main study looking at drug use among trans people in the UK, and they found 1 in 4 trans people had taken drugs in the past 12 months. The most common drugs were cannabis, ecstasy, and amyl nitrate / poppers. And 62% were identified as alcohol dependent or engaging in alcohol abuse. So what about sexualized drug use and trans people? Well, the answer to that is even less. So for my PhD, I did a systematic review looking at sexualized drug use among LGBT people. So this was an international literature review looking whether countries had published data for LGBT people. And this image shows which countries had published on certain LGBT groups. So as you can see from the image, quite a few countries have published data on sexualized drug use among men who have sex with men. There were 2 countries that published research on sexualized drug use in the USA and Vietnam with men who have sex with men and trans women. And 1 country had focused only on trans women, and that was Brazil. So there were no data for cisgender women who have sex with women, no data on trans men and non-binary people. And we should bear in mind the criteria for the review was quite strict. So this was quite limited, but I do believe this is reflective of the overall research literature in that there isn't that many research studies on trans women, trans men, non-binary people, and cisgender women who have sex with women when it comes to sexualized drug use. So in terms of my research aims were to investigate drug use, sexualized drug use, and chemsex among all LGBT people, and to understand the psychological impact, if any, drug use, sexualized drug use, and chemsex is having. And so to do this, I designed the Sex and Lifestyle Survey. The Sex and Lifestyle Survey was an online survey that people would take, and we used this to help answer these questions. We used Facebook advertising to recruit participants. So as you can see, there's an advert here for men who have sex with men, an advert for women who have sex with women, an advert for trans and non-binary people, and an advert for LGBT people generally as well. So participants would click on the link and this would take them to the online survey. We also used community organisation posts to help recruit participants, and there was a prize draw as an incentive for people to take part. So in terms of asking people about their gender and trying to capture trans people, what we said, we used the following questioning. Which of the following best describes how you think of yourself? Male, including trans man, female, including trans woman, non-binary, in another way, please specify, or prefer not to say. And then we followed this up with another question asking, is this the same gender you were assigned at birth? Yes, no, or prefer not to say. And anyone who said that this wasn't the same gender they were assigned at birth, as long as they didn't say prefer not to say, they were then identified as trans. In terms of asking people about their drug use, we asked, in the past 12 months, have you taken any of the following? Please select all that apply. And we then followed this up by asking, in the past 12 months, have you had sex under the influence of alcohol and cannabis? Then for all other drugs, you were asked, had you taken any of these drugs immediately before or during sex? And if someone selected ketamine, GHB, GBL, methadone, or crystal methamphetamine, this was grouped as chemsex. And then in terms of the psychological aspect, we use the psychological distress scale. This was 10 questions, and we asked, in the past 30 days, how often have you felt tired out for no good reason, nervous, hopeless, restless, fidgety? And people would answer this by either saying none of the time, a little of the time, some of the time, most of the time, all of the time. And this gave us an overall score. So we added this up and divided this into 4 categories of normal, moderate, high, or very high levels of psychological distress. So in terms of the results, I had 3,507 surveys completed, and this shows the breakdown among men who have sex with men, women who have sex with women, and trans people. So these groups aren't mutually exclusive. So for example, if a trans man also reported having sex with men, they would be included in the men who have sex with men category and the trans people category. The mean age was quite young, and a large proportion of my sample were majority white ethnicity. And this image just shows the geographical breakdown of where we recruited participants from. So we didn't get anyone from the Shetland Islands. We got a couple of people from the Orkneys, and we had good geographic representation across Scotland, England, and Wales, apart from this one area in the middle. And in terms of Northern Ireland, we had fairly good representation across Northern Ireland as well. So I've just included this to show that this really was a UK-wide survey, and we did manage to recruit all across the UK. So in terms of the questions, like I said, we asked, in the past 12 months, have you drank alcohol, had sex under the influence of alcohol, had engaged in drug use, engaged in sexualized drug use, and engaged in chemsex? So we have similar proportions of men who have sex with men, women who have sex with women, and trans people engaging in who drank alcohol. And we found that men who have sex with men and women who have sex with women were slightly more likely to report having sex under the influence of alcohol. But this was similar across all groups in terms of drug use. So around 50% of the categories reported engaging in drug use. In terms of sexualized drug use, men who have sex with men were more likely to report engaging in sexualized drug use, and men who have sex with men were more likely to report engaging in chemsex, where men who have sex with men were 10 times more likely to report engaging in chemsex compared to women who have sex with women, and 6 times more likely to report doing this compared to trans people. So chemsex was those 4 specific drugs of crystal methamphetamine, GHB, GBL, ketamine, and methadone. That being said, this does show there are some people who are women who have sex with women and who are trans people who are engaging in this behavior. So although it's a smaller proportion, it does exist in other LGBT people, not just men who have sex with men. So I'm going to move on now to focusing solely on trans people. And we found that 40% of trans people, 45% of trans people had engaged in drug use in the past 12 months, and 21% of these had engaged in sexualized drug use. So what does that look like? So this is the breakdown of drugs, popularity of drugs among trans people. So alcohol was the most popular, followed by cannabis and poppers and cocaine and ecstasy. So this is a similar popularity of drugs that we found in the trans mental health survey. However, we did find these at a higher proportion. So this is probably down to our recruitment methods, because we used Facebook advertising, and the previous study had used a snowball sample where one person recruited another person and everyone who's recruited knew each other. So it may have not be as representative. And similarly, these drugs had a similar popularity among men who had sex with men and women who had sex with women. But men who had sex with men reported a higher proportion of taking those chemsex drugs. So then we wanted to look at what factors are associated with drug use among trans people. So the columns in blue are where there is a significant difference within that group in terms of more or less likely to engage in drug use. So as you can see, for trans people, there was no significant difference in engagement in drug use across trans people's gender. Those that had an increasing number of male anal intercourse partners were more likely to engage in drug use. Similarly, those who had an increasing number of female sexual partners were more likely to engage in drug use, as well as those that attended a sexual health clinic. We found that 82% who reported experiencing sexual contact without consent in the past 12 months were more likely to report engaging in drug use also. So we can't infer causation here. So we don't know the direction of these results. We don't know whether a trans person engaging in drug use may be more likely to experience sexual assault due to potentially be more vulnerable, or whether trans people may be using drugs as a coping mechanism for experiencing sexual assault, or whether there is some other third factor there, for example, engaging in sex work, which is related to both drug use and sexual assault. And we found no difference in terms of psychological distress and engagement in drug use. This is probably because among trans people, 80% had a high or very high levels of psychological distress. So it came across as though trans people have a lot more going on than engaging in drugs, and that is not the biggest factor contributing to trans people's mental health. And we also found that those who are younger were more likely to engage in drug use. So then we looked at sexualized drug use compared to drug use. And again, we found no difference across gender categories among trans people. We found that trans people of color were more likely to engage in sexualized drug use compared to drug use and compared to white people. It looked as if though being single was a protective factor against engaging in sexualized drug use. So being single, people who were single were less likely to engage in sexualized drug use, which sort of says that this might be happening within relationships. Again, an increasing number of anal intercourse partners was associated with engagement in sexualized drug use. There's no difference among number of female sexual partners. Again, those who had attended a sexual health clinic in the past 12 months were more likely to engage in sexualized drug use. And those who rated their health as bad or very bad were more likely to engage in sexualized drug use. Again, we can't infer causation around these results, so we can't say someone who is engaging in sexualized drug use, this is having a bad effect on their health. So moving on now to motivations and effects of sexualized drug use. So this shows various motivations and effects among trans people between those who engaged in intentional sexualized drug use, those who engaged in sexualized drug use under the influence of cannabis, and those who engaged in sexualized drug use under the influence of alcohol. So trans people who reported engaging in intentional sexualized drug use were more likely to report doing so because it allowed them to have sex for longer. It was a more intense sexual experience. There was no difference between groups stating that they engaged in sexualized drug use because they felt pressure from friends or pressure from their partner. A high proportion across all categories said they enjoyed their sex life and they were in control of their actions, which is really good because it's not saying this is necessarily having a negative effect on people's lives. And we found that only a small proportion, 7%, stated that alcohol and drugs and sex is having a negative effect on their life. So again, these findings were similar to men who have sex with men and women who have sex with women, in that people reported engaging in sexualized drug use for a variety of reasons, and sexual pleasure was one of them, and that there wasn't a big effect on people, but there were people who didn't need further help and support, and help and support services should be available for those who need it. So what does this mean? So we found that sexualized drug use and chemsex was observed among trans people, although this was to a lesser extent than among men who have sex with men. We found that this did exist and it was there. We found that trans people take drugs for various reasons. Most trans people reported being happy and content in their sex life, and that is good. Other people reported that it was having a negative effect on them, and if it was having a negative effect, they needed further help and support. So more research on trans people and drugs is needed to understand potential harms, and that is related to that we can't infer causation among any of our findings. So like I said, we can't say for definite trans people who engage in drug use are more likely to experience sexual assault, or whether drug use is maybe a coping mechanism for experiencing sexual assault, or maybe it's a bit of both. This finding was also among women who have sex with women, so maybe there is something there that drug services need to be aware of, that experiencing sexual assault can be quite common among people who engage in drug use. And there was also a sexual risk there for trans people who are engaging in sexualized drug use. But conversely, those who were engaging in sexualized drug use were more likely to engage sexual health clinics. So that's good in the sense that people felt they had autonomy over their health and potentially preventing onward transmission. So generally, LGBT people beyond men who have sex with men should be included in drug use research where appropriate. And UK LGBT research should aim to be more representative of LGBT people of colour. When I started on my PhD and I started on my research, I had no idea that using Facebook advertising would produce such a bias in my research in terms of ethnicity. So I do recommend that anyone out there who is looking to engage in LGBT research to engage with LGBT organisations specific for people of colour, such as Black Pride. And it's unclear how representative this research is of trans people. So there's no data on how many trans people are in the UK. Like I said, there was that census in 2021, but that may leave more questions than answers. And previous research has found that using Facebook advertising can gain a representative sample when researching people who take drugs. So there's that to bear in mind when interpreting the results as well. So just to say, these findings were part of my PhD, and we also have a paper out that looked at sexual health clinic attendance and HIV testing among trans people. And these are publicly available, so you should be able to look at these if you want. And we also have other findings from the PhD looking at psychosocial and sexual characteristics for men who have sex with men engaging in sexualized drug use. We've got a paper on image and performance enhancing drug use, a paper on findings for the women who have sex with women, and a paper on accessing pre-exposure prophylaxis and sexualized drug use as well. But I just want to end with a quote from some qualitative interviews that I did. So I also did, as part of my PhD, other research looking at service provision and barriers to care for men who have sex with men who were engaging in chemsex and sexualized drug use. I know this isn't trans-specific, but I think the quote is quite applicable to all LGBT people. So this person who I interviewed, he was happy with his engagement in sexualized drug use. He said he was engaging in chemsex and he was having a good time. He felt in control. However, he said that he's previously sought support for drug use, and that was through a sexual health clinic, and they referred him to counselling within the sexual health clinic. He said he had a happy life. He'd never had problems relating to his sexuality, and he was quite taken aback with the counsellor's perceptions of what someone who needs help with drug use looks like. So the participant said he was like really surprised that I was still in touch with my family and they were accepting of me being gay and I'd come from an okay family. Like he was just really shocked that I needed help. So that made me feel like, do I actually need this help? Am I kind of valid for it? Or am I just being ridiculous? So then when it gets to the point that I know I need help, I'll just sit there for days and be like, do I actually, or am I just being an idiot, you know? And they're just going to ask me the same questions and then tell me that I don't fit into that box, so I don't need that help. So this says to me that we need caution when attributing reasoning to LGBT people and men who have sex with men when they're engaging in sexualized drug use and drug use, or if they have problems. You know, some people engage in drug use because it's fun, they enjoy it, they're happy. But when we try to see every problem an LGBT person has through an LGBT lens, then that can actually be a barrier to care. And this relates to the headlines at the start, because the only narrative that most people hear of chemsex and sexualized drug use is a bad one. And if someone is having a bad experience, but they don't necessarily relate to that, that can actually then put them off seeking further help and support. So I just want to say a quick thank you to my supervisors, Vivian Hope, Caroline Brett, and Lorna Porcelato. I'd like to say a quick thank you to all the LGBT organisations that helped with the design of the survey, the recruitment of participants, and the interpretation of results. And I'd like to thank all the participants for taking part, and I want to thank you for listening. And I think Dean is going to talk now briefly about a trans and non-binary alcohol survey that he's currently leading on.
Hi, Matt. Thank you so much for that talk. That was really interesting. Yeah, I just wanted to draw everyone's attention to this study that Dr. Emma Davies and I are running with the support of Drugs and Me and other collaborators like Matt's. The study is based at Oxford Brookes, who approved it ethically. The idea of the study is to gain an understanding of alcohol use among trans and non-binary people here in the UK. A few years ago, when I was doing my master's, I did a systematic review trying to summarize as much of the existing literature on alcohol and other drug use among trans and non-binary people globally. And what I found quite striking was there was no research about alcohol use from the UK. And I felt that this was a shame that trans and non-binary people in the UK are not represented in the literature. There were a number of reasons for this. The one that seemed to be pervasive and commonly reported, pervasive in the non-specialist literature and commonly reported as a limitation by the specialist researchers, was the way that gender is measured. In that, in population surveys, typically gender is measured as a binary with no consideration of the fact that gender may differ from that assigned at birth. So what we're trying to do is to overcome this limitation in the literature by giving a voice to UK trans and non-binary people so they can tell us the truth about what their alcohol use is like. We're not setting out to pathologize or to say that that alcohol use among any community is not without benefit, that people don't have very good motivation for drinking alcohol at times. What we're just trying to do is to understand if people are experiencing harms, what those harms might be, and what we can do to support them. We're hoping that this will be the beginning of a series of projects that will inform relevant and culturally competent health messages and appropriate specialist services if these are found to be appropriate. So thanks very much. I really, really appreciate if you do identify as trans or non-binary, that you take part in the survey. We're hoping to have 400 participants, and we need everyone who can to please take part, so that the time spent by your peers in taking part isn't wasted. So we want the results to be as meaningful and as powerful as possible, and every voice really counts. So thank you very much, everyone.
Cool. Thank you, Dean, and thanks a lot, Matt, for the talk. I think now we can have there are a few comments on the chat, and we can also, I guess, one challenge, or one comment I want to make, because I know some of the research, like one of the motivations, or Dean's motivation to do this project, this research, is Matt's research. So I guess like Matt is happy because he's gonna have a few references more, and like his work is gonna be cited. But I guess, do you think one of your points at the end is that more research is needed, and yeah, and we've like talked about the reasons and etc. Like, do you think this particular survey is focusing on one of the most pressing like problems or issues that you encountered in your research, or what are the other areas that you think are also neglected that should be further investigated in hopefully these series of projects that Dean has mentioned?
Yeah, I mean, I think when it comes to trans people, there's just nothing out there, like so little in terms of anything really. So like, especially when it came to drug and alcohol use and sexualized drug use, there just wasn't any research internationally, never mind in a UK context. So it really helps to just have anything out there, because although my study did have some interesting findings, it's hard to draw a conclusion on one study. The more studies that we have saying the same thing would really help, elevate trans people's voices, elevate any findings in terms of needing further help and support, stuff like that. I don't know, Dean, if you want to add anything to that.
Sorry, I need to keep myself unmuted. I think there's such a broad scope for the literature to expand. And I think what I would like to see is a move away from particularly trans women being conflated with, categorized and conflated with men who have sex with men because of one shared public health risk, I guess. I think allowing trans and non-binary people, and particularly subgroups of trans and non-binary people, as we move towards having inclusive population-based surveys, to be investigated independently, will give a more accurate representation of the subcultures within subcultures, and allow us to properly tailor any sort of clinical input that's needed towards the individual.
Cool, thank you. So I want to pick one of the comments in the chat. That is, the first one is from our UK surveys, which I think they operate in Brighton and somewhere Hove. I don't know, that's the way you pronounce it. But the first comment is basically that I think in one of the graphs that you showed, Matt, in which you show the different drugs that are used, or that you asked in the survey, and the like percentage of use. Someone mentioned that they were surprised by the lack of benzo use, as that's what they see huge amounts of use of benzodiazepines. Did you not include these in your survey, or was there no people?
Yeah, so that's definitely a limitation of the survey, that we didn't actually measure benzo use. We did have a few people use a free text field to say benzos, but again, like I said, it wasn't that measure, so that is a limitation, definitely.
Okay, and why did you make that decision at the time?
I used a very similar questioning to a European men who have sex with men survey, looking at all those similar drugs, and I don't think they'd included benzos, but that was in 2014, and my survey was in 2018. So that's, that kind of, I think that's when things had sort of changed, and yeah, it would have been great to include, but unfortunately not.
Okay. Yeah, there are always like time and resource limitations in research, so compromises must be made. So then there's another question by also our UK surveys. It goes to both of you. So one is about the age group, I think. Like what was the age? Did you exclude any ages or?
Oh, right, yeah, sorry, yeah. So the people had to be over 18 to take part.
Okay.
Like that's quite common when researching, like ethics committees don't usually approve anything for under 18s, or if they do, it requires an extra level of scrutiny.
Yeah, fair. I guess is it the same for you, Dean?
Yeah, the systematic review we did at King's was for adults only, and the other work we've done on drug use among trans and non-binary people has been with the Global Drug Survey, which is for adults as well. So I think there is a small body of literature looking at drug use among gender diverse children and adolescents, but
Yeah.
there are only a few studies.
Yeah, I imagine that's when a lot of the problematic relationships with drugs are developed. So it is, or what do you think about that comment?
I think adolescence can be a very difficult time for any LGBT person, but particularly if you are going through a puberty that doesn't fit with your identity, or you're developing in a way that causes you distress, then I think it would be unsurprising. I'm not an expert in this literature, so I can't say with certainty, but it wouldn't surprise me if people were using a lot of drugs and alcohol and other drugs to cope with those feelings. We see that drug use to cope in many other areas, so it wouldn't surprise me if there was disproportionate use starting there.
Yeah. For some of we've done a few surveys within the UK and also globally, and it is we've used our main aim was to basically tell unis that they had to do something about drug education and drugs in general, and not surprisingly, most people who go to uni, they've already like engaged in drug use before, but then especially alcohol use, like many other drugs are like students are exposed to them at uni, but I would imagine so I don't know if you I know Dean, you talk about in your systematic review, you talk about the minority stress theory. I think, Matt, you haven't touched on that, but I was wondering whether you could, Dean, could you briefly explain that to the people in the stream, and whether, Matt, do you have any thoughts about that theory and how it could explain some of the patterns in your survey? So yeah, Dean, could you briefly explain that theory first, please?
Sure. So minority stress theories, I think began around 2003. A researcher named Mayer characterized or identified that there were three main vulnerabilities that LGBT people, at that time I think it was LGBT people that were being discussed, were experiencing, that exposed them, that created a greater risk for affective disorder and addiction, or problematic drug and alcohol use generally. So they were internalized stigma, so essentially internalized homophobia or transphobia as it was later developed, enacted or anticipated discrimination. So the living with the threat of hate crime, or the threat that someone might attack you, or you might get dismissed from a job, or housing, or all of the things that even now, I guess 20 years down the line, that many LGBT people face daily. And the third one was concealment. So concealment, hiding one's identity. And those factors were together considered to contribute to a psychological state that for some people necessitated alcohol and other drug use to cope. So that's how my understanding of how it developed. And it initially was, as I say, for lesbian, gay, bisexual, and other sexual minority people, and then was later developed in 2012, I think, into a gender minority stress model.
Okay, thank you. I know you focus both in like positive and like negative motivations, and less on problematic use, which is, I think, this theory tries to explain the development of problematic drug use. But do you have any, how would you explain some of your results with this framework?
Yeah, it's a really good question. And I actually went into my PhD looking at minority stress as well. So going into it, there was some research and a lot of news headlines around chemsex specifically being like the men engaging are doing so because they've got internalized homophobia. And I was going into my research actually expecting to find that. And I did measure internalized homophobia, experiences as discrimination, self-stigma among trans people, as well as the other mental health measures. And there was no finding of internalized homophobia among men who have sex with men engaging in chemsex or sexualized drug use. So I found that really interesting because it sort of said there was no evidence for minority stress, at least among men who have sex with men, in terms of their experiences of internalized stigma and experiences of discrimination. And I think that's a narrative that's out there a lot, but there's also a lot of other people engaging in that behavior that don't relate to that. And I think that can be a barrier to care. In terms of women have sex with women, there were actually evidence of minority stress for drug use and sexualized drug use. And for trans people, in terms of drug use and sexualized drug use, we didn't really find evidence for minority stress. But in the paper looking at HIV testing and sexual health clinic attendance, we did actually find evidence of some minority stress factors, such as self-stigma and experiences of discrimination, resulting in a lack of access to healthcare.
Yeah, one thing I particularly like about the research that you've talked about today on like the papers is that you talk about both the positive and negative motivations, the positive and negative effects, because many times in like harm reduction, we focus on the aspect of reducing the harm, but it's important to remember that often people start using drugs for the fun and for like because it feels good for some reason for most people, but then for whatever reasons, your relationship with substances can like go wary and end up harming you. So one thing that I was wondering is, because I understand that different populations have different challenges in society, and they are like treated in different ways, and this is hopefully changing slowly. But it seems to me that, maybe I'm wrong, I'm happy to be challenged. It seems to me like, do you think the positive reasons, or the positive motivations, such as like taking drugs for fun, are the same across different sexual identities and like different populations, but the negative ones are more specific, or are both specific to each person's cultural, sexual, etc. background?
I think something that gets overlooked a lot in research for LGBT people and drug use and sexualized drug use. I mean, I think I'm quite guilty of overlooking this until I did the qualitative interviews as well. But people doing it because it's a social norm as well. Like, not in the sense that like people feel pressured to do so, but I think historically there was this sort of gay people and gay men, gay women, trans people using drugs as maybe a coping mechanism for how society treated them. And I think this has created a social norm nowadays of quite higher levels of drug use among LGBT people. I'm not saying everything is perfect, and there's not going to be people who are using drugs who aren't using drugs because of their sexuality, because of their gender identity. But I think that there is this social norm as well, and like you say, they do it because they're fun and they enjoy it. But when does it become the harm, and when do people need further help and support?
Dean, do you have anything? Do you want to add anything or a challenge?
Yeah, I guess I'd just jump in there with the LGBT people have come together historically in exile, essentially, and sort of celebrated community connectedness in a culture of alcohol and other drug excess. So I think it is very culturally specific. I think historically, the choice of drugs that LGBT people have used has differed from sexual and gender majority people. And I think as well, going back to the minority stress models, one of the facilitators, one of the factors that eliminates or ameliorates minority stress is community connectedness. So people now, I can only speak for London, but the sort of LGBT scene in London is slowly closing, which was hastened by the pandemic and the social restrictions and the financial implications of that, which is resulting in more people engaging in sexualized drug use or chemsex. It depends how you want to define it, and maybe we can have a chat about that after. But I think that also contributes to more people. The more people that are engaged in chemsex, the less people that are out clubbing or using club drugs or drinking alcohol in bars and pubs, which contributes to more shutting down. And then I think what's common is the need for community connectedness, which is kind of what we've been seeing in an unpublished or yet to be finished review about changes since the pandemic.
But do you think there's common to any individual? Like, I think in general, connectedness helps in general with whatever challenges you're facing in your life, or is there any particular? Because I know there are like challenges for your systematic review, and what some of the things that Matt has mentioned. There are particular challenges faced by how you look like, unfortunately, and how you move, how you behave. But in general, connectedness seems to help with any mental health or well-being issue. But I guess what would you highlight about this connectedness that particularly helps the LGBTQ community or people that are there and have problematic drug use, for instance?
I think if you develop in a culture of exclusion and fear, which many LGBT plus people do, then once you have the opportunity to connect with people who have shared that experience, then there is an element of assimilation to facilitate that connection, and a consequence of that is that people can become quite dependent on those, or can and do become dependent on those relationships and the culture in which they exist. And I think it's just a pattern of, I guess things evolve over time, but I think this has existed for a very long time. I think, yeah, I'll just leave it there.
Okay, thank you. I just want to end now by talking a bit about the implications of first, like, Matt, do you think, or are you aware of any implications, or like have you been after? I know, like, and when you're doing your PhD, you get a narrow focus on your data and your methods and stuff. But then I know that you've moved away from academia, and are there any positive social implications that follow from your research, or are you still maybe working on this to see change based on the findings that you've talked about today?
I think it's difficult because if I only look at things even through like an academic lens, an academic's perspective, the impacts that the men who have sex with men findings is still being elevated a lot more than the findings for women who have sex with women and findings for trans people. I think one positive impact I saw, at least from the findings from men who have sex with men, because although I did mention that there is this people engage in it for lots of different reasons, there is people who will experience sexual assault or be unsure of experiencing sexual assault when engaging in sexualized drug use and when engaging in chemsex. I think the narrative around that has, developed since my research and since other research highlighting this, and just making people aware that this may be a problem and how to look after yourself and how to look after others if someone may be, experiencing a bad turn whilst engaging in that. But like I said, unfortunately, I haven't really seen, apart from Dean reaching out to me, I haven't seen any positive impacts of my trans research. And again, I think that's reflective of like the historic exclusion from research that trans people have experienced.
And from the LGBT community as well.
Yeah.
It's exclusion at all fronts, yeah.
Okay, so Dean, I think one of the good recommendations in your, or like conclusions in your systematic review is that health workers should get a special training to understand the specific challenges that trans and non-binary people face and how those challenges may contribute to the development of drug use. Could you maybe, how do you think this survey that you're running right now is gonna contribute to that training or that like advocacy of improving the skills of health workers in this sense?
Yeah, so what we found in the review was, or found I think more in the literature surrounding the review, was that there were a small number of studies commenting on exclusion of trans and non-binary people from US-based alcohol and other drug use reduction services. I think I would hope that what we can learn from our study is sort of what the audit scores are, or like what the harm experienced by trans people from alcohol use is. And I think that will maybe give us an indication. I should say that this is introductory work, exploratory work. So it's about beginning to set the scene. And so I guess it will hopefully give us an idea of the severity of harm experience, the motivations for use, which I guess can be challenged in certain therapies if people are experiencing a lot of harm, or using alcohol for negative reasons or to cope with distress. Then perhaps if that distress could be identified and managed, then the harm from alcohol could be reduced. Similar to Matt's work, we touched briefly on sexualized alcohol use and experiences of sexual violence while under the influence of alcohol. So I think these are important things that we need to be aware of when we are working with service users, whether these are experiences that they may have had. But I think also just getting some evidence of the fact that of how trans and non-binary people are using alcohol will just give us an idea of, beyond the general cultural competence, what providers need to be aware of, how that might differ from a cisgender client coming through the door.
Because this is like we've touched on the healthcare system and like workers. What about a lot of the people that like follow Drugs.me are convinced that drug laws should change, and this is like beyond gender and like sex discussions. Do you think this type of work could contribute to the improvement of drug policies beyond just the specific beyond the specifics of trans and non-binary people, how can this help to improve drug laws as in general? Do you have any thoughts about that, or is that a big leap to make?
It's a huge leap. What do you think, Matt?
I think it's really interesting, and like from a personal perspective and a professional perspective, when you're looking at HIV and hepatitis, and you look at what Portugal did, it's a no-brainer. But
Yeah.
whether my research could actually be used in that way, I don't know. Like I don't think it's got that reach.
It will change. I think any policies that help reducing harm and enhancing experiences, I think, will be welcomed by any community that engages with drug use. So that seems like a good way to finish. Do you guys have any final comments that you want to make? Do you want to repeat again, chat about the survey one more time?
Yeah, just very briefly. Firstly, thank you very much, Ivan, for having me here and for helping us with the survey. It's hugely appreciated. Just one last time, everyone. It's a survey of alcohol use among UK-based trans and non-binary people. We're not aiming to stigmatize alcohol use, and we're not going into this with any assumptions about how trans and non-binary people use alcohol. We just want to offer you an exploratory survey where you can tell us what it's like for you. So please fill in the survey. We need 400 responses in order to have good, strong results that will allow us to inform future research and start to begin to develop relevant health messages and advise alcohol reduction service providers of what the needs are for those who are experiencing a lot of harm from their alcohol use. So please do participate, and thank you very much, Ivan.
Thanks, Dean. Matt, any final comments?
Yeah, no, nothing for me. Thank you very much for organising, Ivan. It's been great.
Thank you both, and there's been thanks in the chat box. The talk is going to be available after this, so feel free to share it around. You can also share the survey with other peers, and if you like to hear more about drugs, we've got the next talk organized is going to be about vulnerability, specifically in women who take drugs. So it's going to be by Alex Aldrich, who's about to read her PhD thesis, and she's done a lot of research about sex and drugs in many different ways. And I think the link is in the caption, so you can grab your ticket now. It's going to be in a month's time, but you should get the ticket so you get reminders. And that's everything for today. Thank you, Dean. Thank you, Matt. And